In this video, I'm going to show you some techniques you can do to decrease your neck pain and improve your range of motion. Our first technique, we're going to use a pillowcase to assist with rotation of the cervical spine. What you're going to do is put the pillowcase right behind the neck here, below the skull, and I'm going to turn my head to the left. As I turn my head to the left, I'm going to pull with my right arm up through, kind of at an angle up through my eye and up, and then I'm going to come back down. I'm going to turn my head back to the left, pull the pillowcase up again, and back down, then repeat that to the opposite side. So turn my head to the right, and then I'm going to pull with my left arm, pulling up at an angle kind of through the eye. You're going to feel that pressure in the back of the neck. Repeat that between 10 to 15 repetitions to each side for a couple of sets a few times a day. Next is going to be taking a tennis ball. We're going to put it in that pillowcase. You can put it in a bag or just whatever you have, just so that you don't drop it when you're trying to go through this movement. And we're going to put that right between my shoulder blades. We're going to start on the left side. You're going to lean against the wall. So I'm going to lean back. And now what I'm going to do is, while I'm holding that pressure, I'm going to turn my head to the right and then back to the center. So if the tennis ball is on the left side of my spine, I like to have my patients turn their head to the opposite direction. So we're going to go to the right and then back. And then you're going to switch that over to the other side. Now the tennis ball is on the right side of my spine. As I lean back, I'm going to turn my head to the left as far as I can and come back. I repeat that for 2 to 3 sets of 10 to 15 repetitions a few times a day. Next, we're going to use a foam roller to work on thoracic extension. Now, a lot of times people use foam rollers if they're lying on the floor or maybe on the bed to really work on going back into that thoracic extension. We do know that the thoracic spine can have a contribution on cervical neck pain as well as range of motion. So what you're going to do with this in standing is put this against the wall, and then we're going to come in here about the middle back. You can kind of adjust. If I squat down a little bit, I can adjust where the pressure is. And then I'm going to work on just leaning back over that foam roller. Just focus on going back as far as I can. And I may kind of adjust where I'm at on that, stand up a little more, maybe bend down a little more, work on going back over that foam roller. But I would repeat that for 2 to 3 sets of 10 to 15 repetitions several times a day. Now, to strengthen the cervical spine, what we're going to do is take a band. You're going to put this behind your head, so like this, and you're going to work on retracting your head, so kind of bringing your head straight back, kind of tucking in your chin a little bit. So going to pull back. And we repeat that for 2 to 3 sets of 10 to 15 repetitions. And that's also something you can perform a couple times a day. Our last exercise is going to be a standing shoulder shrug. So you can take dumbbells, get a weight that's easy to handle. You don't want to go too heavy at first. You're just going to shrug your shoulders up as high as you can. Really bring them up, hold them up there, maybe 5 to 10 seconds, and then come back down and go back up. Squeeze really hard, hold it for 5 to 10 seconds, and then go back down. You perform that for 2 to 3 sets of 10 to 15 repetitions a few times a day.